Hello, welcome to MRIcardiac.com. This is third topic in series of improving CMR image quality, and today we will deal with CMR scanning with devices. So the devices can be classified whether they are MR safe or compatible. This will include some plastic material which do not cause any hazards in any MR environment. MR conditional. Basically, this has some specified conditions of use and some specific configuration is required. This will include new generation pacemakers or AICD devices, and MR unsafe, like few of the cochlear implants are never to be taken in any of the MR environment. Safety can be checked on mrisafety.com. The name of the device can be typed over here and it will be revealed whether it is MR conditional or MR unsafe and what are the conditions prior to its usage. Potential risks of devices include mechanical effects like device can get displaced, thermal effects like there could be some heating or the burns related to the leads, and some electromechanical interference like power on reset mode with any of the switch, some pacing inhibition. So all these are the potential risks. It is important to make sure that implantation is done before 6 weeks of MRI. It is thoracic or a pectoral implantation. There are no abandoned or fractured leads, no adapters, no extenders, and the leads are electrically intact. It will be a good idea to have a prior chest radiograph. Like for example, this is a lead fracture which can be seen. At the time of appointment, verify that device is MR conditional and also identify whether patient is pacemaker dependent or not. Because before the scan, you will require some programming, and depending on whether he's dependent or not dependent, the program will change. Before the scan, the company person has to be called and he will keep the MRI mode on that device. Try and expedite the scan. Do not take any extra sequences. Make sure that you have an adequate staff and defibrillator devices, etc. available outside. And immediately after the scan, the programming has to be done and the MRI mode has to be switched off. Few tips for better scanning images. Try inspiratory images and hand above head. Basically, this will increase the distance of cardiac chambers away from the device. We can try spoiled GRE or gradient echo images like flash compared to normal routine Cine SSF images. LGE, late gadolinium enhancement, like wide bandwidth sequences are to be used. So this is an example of SSFP image. And as you see over here, there is a lot of off resonance artifacts. While moving over to GRE images, though there would be some degradation of the image quality or signal to noise ratio, but we can still get better images even with devices. So even with a lead in place, these are the GRE images in long axis and short axis images of the heart. We can still get good images of LV myocardium and reportable image quality. Late gadolinium enhancement, which are very crucial, but they can have a lot of artifacts, especially because of the signal void and some hyper intensity artifacts. That time it can be switched over to wideband late gadolinium enhancement. Maximum bandwidth available on your scanner should be tried, and then we can still get reportable images. Using flash or a gradient readout will be also another technique which can be tried, and they are robust to arrhythmias and breath holding artifacts, and at least then we can get good reportable image quality as seen in this case. Any feedback and suggestions, please mail us on info@mricardiac.com. If you have any idea for any topics to be covered, please mail me on priyachudgar@gmail.com. Thank you.